I was diagnosed in April 2021. We were in the pool, my mom noticed it. Then that's when we were like, okay. I didn't think it was scoliosis because I was gaining weight, so I thought it was just fat. But my mom was like, nah, your back is not symmetric. So immediately she called our doctor. He diagnosed me with scoliosis. Then we went down to Miami and we went to a surgeon. He said, yeah, you need surgery for this. I didn't even notice I had scoliosis, so I didn't feel it. I thought I was normal for the most part. At first, I was scared because, when I think of surgery, I think of, oh my God, they're gonna put me like in this room, anesthesia. I don't know how that works. So I thought I knew I wasn't gonna be awake during it, but it's like the thought of being asleep immediately just scares me.
Scoliosis surgery leaves a lot of variables that we don't know. Now, immediate responses or negative responses to surgery are things like infection, or allergic reaction to the rods, or something wrong with the anesthesia, and that can be very immediate. And those things that people tend to see and they feel at that moment. Now, that's not a huge percentage of patients, but it is something to consider. That percentage is probably somewhere around 1 or 2%, something along those lines. There's some kind of negative reaction to the initial surgery. Now, obviously, we say if we can avoid the surgery, that would be a better thing because that risk is an unknown variable. But even better, if you can reduce the curve, make the curve straighter, and prevent surgery and hold that reduction throughout your entire life, well, that seems like the best approach because you're not dealing with the evasion of the surgery and you're getting the benefits of a reduced curve, and you're avoiding all the side effects possibility that could happen later on in life because of the surgery. So therefore, reducing those risk factors are what motivate us to continue to help patients like Jonathan.
We were about to get sent into the surgery. It was almost there. Then we had some complications go down, and it's like, okay, we can't do this. So we went, I dressed up, went out. After we first came here, Dr. Tony showed me some patients, former patients that had even worse spines, worse than me. After seeing all that, I wanted to prove I could do this. What really made the treatment a lot better was that, I could use my phone, so it passes the time a lot. So it's you're not even noticing you're doing treatment. You're just it feels like you're just at home. You're just doing a couple things.
Our intensive therapy or therapy in the clinic relies heavily on something we call passive rehabilitation. Now, passive rehab in the scoliosis world is not really used. And I think that's a big miss on a lot of these people that say they specialize in scoliosis. Because one thing we know about scoliosis patients and every type of scoliosis curve is that it's a structural component. The patient does not have the ability to undo that curve under their own power, own motion, or own movement. Those are the machines that we see in our videos or they see when they walk into our clinic. And those machines, even though they kind of look intimidating, they're actually not, because all they're doing is applying pressure or a force into an area where the person can't physically move to try to make the spine more flexible in those areas. Most patients, scoliosis patients, feel it helps them. They feel a release that they couldn't achieve on their own. It's kind of like they're trying to stretch, but they can't stretch it because they can't move it. And therefore, most patients notice when they actually do it, oh, it's not that big of a deal. It's relatively gentle, and it's really applying that pressure to an area that they want to have that pressure applied to. And the best thing about our therapy, it's the patient's driving the car. I mean, they have control over the forces and how much force is being applied to their body. So if they want to decrease their force or increase their force, they can total control over that, because not only they have the ability to maneuver those force devices, but we also have therapists there helping them get in and get out and get through that equipment.
You get used to it. It feels like nothing. It's all right, do this. And every day I count up how many things I have to do in the day. And I'm all right, 1 down, this more to go. I keep going, lunchtime, do it again. My curve was at 56. Now it's at 41. So 15 degrees off, that's big. So, imagine in a couple months or in a year, that's a game changer. It's crazy to think about because it's you're in awe, you're shaping your body. So yeah, it's just really amazing.